So what is Botox and how does it work?
So Botox is actually one of the most common procedures performed worldwide. In fact, it's been around for about 20 years. It's been used in all the countries, and about 30 million injection sessions of Botox have been done, again, worldwide. What Botox does, it relaxes the muscles. It relaxes the muscles caused by repetitive movement. So the most common areas we use for Botox injections are areas in the frown line right here. So you can see if Michelle frowns, you can see a lot of the lines as they form. Also the crow feet area, so this is the little wrinkles that form around the eyes, and also the forehead wrinkles. So if Michelle lifts up her forehead, she doesn't have a lot of lines here, but that's something that Botox can help with as well.
So many people are apprehensive about getting Botox because it's injecting a toxin into their body. Can you speak to that?
Good question. So Botox is actually a purified protein and is derived from a bacteria. It's called botulinum toxin bacteria. Now the doses we use for cosmetic treatments in Botox is usually less than 100 units. For it to be toxic, you actually would have to inject over 35 times or even a lot more than that, sort of intravenously, for it to become a problem. So the tiny doses we inject really are targeted to the local muscles. They stay just in the areas we inject, and it's not a problem. It's not a toxic compound for this, for the body at all.
Who are the ideal candidates for Botox? There are a lot of people who come in and they're very young, 25. Is that an appropriate age to get started, or should we wait till you actually start to see lines and wrinkles forming on the face?
Right, so we see patients for Botox in different types of scenarios. So some people come in for preventative reasons. So it's like an insurance policy, because what Botox does, it helps to relax the muscles. If you relax the muscles, therefore you're not going to get the wrinkles forming. So I'd say my youngest patients coming in for Botox can be, as young as 18. They don't have wrinkles yet, but they put small amounts just to help relax the lines. Now other types of patients that come in are those who already have the wrinkles, and again, it can help. It can help because it relaxes the lines. But ideally, you want to get sort of the treatments done before the lines are too deep, because once they're etched in, it's very hard to reverse sort of the damage, and it's very hard to reverse some of the lines that are deep in the skin. So again, ideally the candidate is the person who just has the lines starting, they're not too pronounced, or even if sort of they're already there, you really sort of want to come in for regular treatments to help to relax the muscles even further.
And how do you quell anxieties about people who are concerned about having a face that's frozen or not being able to express themselves?
Right, and it's a very good question, and it's actually one of, I would say, the most common concerns we hear from patients. They want to look natural, okay? They don't want to look overdone, they don't want to look Hollywood too much. So that's where sort of the art of dermatology and the art of Botox injection comes in, because what we do is we look at the anatomy, we see where the Botox should be placed, and the amounts we put in are really not exorbitant. So all they do is they gently relax the muscles, they don't paralyze them, they don't freeze them completely. So we really work with the patients, because by and large, majority of patients want to have just a natural look. Occasionally, though, those who come in saying I want to have a completely frozen forehead, and again, just we can adjust the dose and work with the patient.
Can patients develop antibodies to Botox? So will it stop working or being as effective after a while over a prolonged period of use?
So it's another good question. It's a theoretical sort of risk or concern, but practically speaking, as I mentioned, Botox has been around for over 20 years or so, and by and large, the majority of patients really have a continuous improvement. In fact, what usually we recommend people come in every 3-4 months, but with time, the Botox can even last longer because the muscles are more relaxed. So practically speaking, we don't really see an issue of antibodies or resistance to Botox.
And there are several products that are comparable to Botox. There's Dysport and now there's Xeomin. Which do you recommend for your patients? Is one better than the other? How do they really compare?
Right, so all those products, so Botox, Dysport, and Xeomin is another one. They are called neuromodulators. So what they do is they penetrate into the muscle areas and they help to relax the muscles. Botox is a product that's been around for longest, as I mentioned, about 20 years. Xeomin is more recent on the market. It's been around in the States. Now it's more commonly used in Canada. And Dysport just came to Canada, again, very recently. They work in a similar fashion because, again, they relax the muscles. The difference is slight amount of composition of proteins that are in in the Botox molecule, in the Botox vial. So there's some differences in terms of how much material you put in. Let's say for Dysport, it's a different preparation technique in terms of how much the substance will travel in the skin. Again, the result typically is similar, and most experience we have is with Botox, although we're starting to try other therapies as well. And again, the best thing to do is when a patient comes in, we do discuss various treatment options and go with the therapy that's the best for them.
Okay, and lastly, why see a physician for a Botox treatment? So one of the things I've noticed is that there are all these med spas cropping up just about everywhere. Mm-hmm. And everyone seems to be offering some form of, filler or Botox injection. So why should I see a physician to do it? Arguably, it's probably more expensive. Is there a real reason why we should stay away from the allure of, Botox, at a, that's offered in a group buying, setting or at a med spa?
Right, so that's another very good question, and as you said, it's unfortunately becoming more and more commonplace. The reality is, though, it does take an art and a science and a technique to know Botox and to understand how the anatomy works. So as dermatologists, we train for many years to understand how the face works. There's a lot of muscles in the face, and we have to know where the Botox should be injected, what can happen with Botox injections, and what are the potential issues that can occur. So we're very comfortable with knowing how to place Botox and how to deal with the after effects. Unfortunately, a lot of spas these days offer Botox. People can see a nurse, you can see somebody who's just taken a weekend course to inject Botox. So what we end up seeing, and I would say see 1 or 2 patients a week, or even a few weeks, coming in after having gone to a spa and have had complications, be it with Botox injections, from fillers, from laser therapies, because they're not getting the same level of expertise. It might be a little bit cheaper. That being said, you actually end up paying more when you have those problems and when the spas don't know how to deal with the issues that can occur. So I'd recommend, listen, it's your face. You only have one face. It's your skin. So take good care of it. Okay, if you have, a good car, you want to take it to the proper shop that knows how to deal with that car. With the same idea with your skin, you want to go to an expert who knows the skin, who knows the anatomy, and it's typically dermatologists and plastic surgeons who are well trained in that procedure.